I'm Shannon Krus. I'm the nurse administrator at Siteman in Shiloh, and I oversee the medical oncology clinics in the infusion room here.
Hi, I'm Jessica McKenna, and I'm the radiation oncology manager for Siteman in Shiloh.
I've been with Siteman since 2004, and I've been at the Illinois location for the past 5 years.
I have been here since November 2020, but I have been with BJC Siteman since 2014.
So today we're here to talk to you about scalp cooling, which is a therapy that we are fortunate to offer at all 6 Siteman locations. Scalp cooling is a treatment that we offer for patients who have a risk of losing their hair during chemotherapy. It is provided for patients that are getting chemotherapy for solid tumor treatments, and we often give it to breast cancer patients. So scalp cooling is a treatment that we give during the patient's normal chemotherapy appointment time. They arrive at the same time they would for their chemotherapy appointment, but we do a pre-cooling that's 30 minutes during their medications they would receive for anti-nausea before the chemotherapy begins. Then they receive their chemotherapy, and they are receiving the scalp cooling during the duration of their chemotherapy. And the scalp cooling then does require them to stay an extra 90 minutes to do a post-cooling session before they leave for the day. Our staff will help patients to make sure their cap is snug. If the cap isn't snug, the treatment is usually ineffective, so we have to make sure the cap is snug and fits them properly. They are actually fitted at their first appointment before they begin chemotherapy to ensure the cap is the right size. They bring that cap then with them to each treatment. Our team member helps make sure the fit is tight and then attaches their cap to our scalp cooling machine for each treatment that they're here. Some patients do experience some discomfort during the scalp cooling. They may have a discomfort from the cold or may have a headache, so we offer them medications like Ativan or Tylenol to help relieve some of those discomforts. Scalp cooling protects the hair follicle, so even if a patient does have some hair thinning or loss while they're receiving the scalp cooling, it will help improve their hair regrowth after chemotherapy. So most patients do keep their hair, or at least some of their hair, if they are getting the scalp cooling, but they have protected their hair follicles with this treatment, and then the regrowth after chemotherapy will be much better. Scalp cooling can improve a patient's quality of life because it allows them to have a bit of normalcy during their treatment. It allows them to keep their hair or reduce their hair loss. And many patients comment that it helps them feel normal when they're out in public or in their normal routines, and they don't have to explain what's going on in their personal lives repeatedly throughout the process. Scalp cooling is currently an out-of-pocket expense for patients, and we are working with our insurance companies and Medicare to make this something that is medically necessary and paid by insurance. We are actually currently doing a trial at Siteman where we are billing the insurance, and we have received some positive feedback so far, and we are very hopeful that one day this will be paid for by patients' insurance. And there also is a foundation for patients right now who are paying out of pocket through Hair to Stay that does provide some financial aid for patients who cannot afford it. The Siteman location in Illinois is special because we've had many patients throughout the years that have not wanted to cross the river, and they are so happy to have Siteman close to home.
This is a great location to just be able to provide services for all of our Illinois patients. I think any Siteman location would be great, but I think if this location is easier for you and you have better access here, then we are more than happy to have you.